Okay, good morning everybody. Thank you so much for coming on this beautiful day. I'm really excited to be able to offer this opportunity for you guys to just have the chance to just listen to these experts on speech, occupational therapy, and mental health. I think that it takes a village of whatever extra information we can get to help our children developmentally. It's always very valuable, so I think this is an amazing opportunity. Thank you to everybody who is giving their time to come help us learn a little bit more. So Nicole is a speech therapist. Nicole Denman, I think we all know Nicole. She's our very own. Nicole will speak first. Maria Paredes is a licensed clinical mental health counselor, so she'll speak next. And then Monica Belanger, I feel like I wasn't going to say that right, is an occupational therapist. So she's going to talk about what she does and how that can help your child. And she has spoken to the teachers before, and we were just all amazed at all of the things that we learned from her too. So I'm excited to be able to share all of this professional knowledge with you guys. So at the end, after everybody talks, then we'll have an opportunity for your questions. And then I also had in the red box that if you didn't feel comfortable like asking the question yourself, if you wanted to put it in the box just so it was more anonymous, we have that opportunity.
Thank you guys for being here. I passed out kind of a developmental handout here. So this has some information just about things you can do at home to promote language. There may be some second language learners here. So if you're speaking two languages at home, keep that up. That's wonderful. We always say more languages is facilitating more language, so that's great. So this first page here, so it might look a little confusing. So you might see a bunch of different consonants on here. This is just saying when the speech sound should be developmentally appropriate. So you'll see, age 2.5, you'll see some sounds through 2.5 to 3. And so that's kind of where we start. We look at those sounds. We look at sounds in like speech sounds at the initial position, medial position, and final position, and at different lengths. So, sometimes there's kids that are unintelligible. They're not able to be understood at just like the isolation, like saying, so we would help them at that level and kind of move all the way to conversation. So as a speech language pathologist, we look at articulation for speech sounds. We look at language, so that's both receptive understanding of language and expression of language. We look at voice. Does the voice sound raspy, or fluency, which is stuttering, if there's any trouble stuttering. And so we also do feeding. So for this age group, we might have a child who comes in and has a lot of different things going on. So we might have some trouble with chewing, feeding, swallowing. We might also have some speech sounds that we're noticing that are kind of not quite developmentally appropriate. So kind of reaching out for a consultation with a speech pathologist is a great idea, just to see if there's any support you can give at home, or if there's anything that you can do with our services. And we like to collaborate with a lot of different professionals. So I'm happy that they're here today because I think it takes a village, like Dana said. And so this handout here should be, you can tuck it away wherever you can refer to it as your child ages. So there's useful tips for language strategies. I'm a mom as well, so I have an 8-year-old and a 5-year-old. And it would have been very helpful just to know what is appropriate and what's not, and what can I do at home to be able to support, my child for speech and language. So once I found these, I think these are very easy to introduce and kind of keep at home. So these are a lot of good language strategies. So I am a speech language pathologist. I've opened up my own business called Rooted Integrated Speech Therapy Center, located in Kernersville. I do see some preschool age students in the Greensboro area as well. My main focus is on oral motor and basically looking at oral facial myology. It's a lot of words. Basically, I am looking in and out to make sure all the structures are appropriate. I look at reflex integration as well for the oral structure. And then I'm always looking to see if there's any red flags for kids that might kind of develop some other things that they need help with in the future. So a speech therapist is not only looking at sounds and language, we're also really kind of looking to see if we need to refer out for other help. And we can talk about that later as well. But, you know, some red flags that I'm always looking for at the preschool age is, you know, is a child sleeping well? So are they snoring? Is a child having trouble feeding, chewing, that sort of thing? Is a child able to kind of communicate their wants and needs? So these are big things at the preschool level. If a child's having trouble with any of those, we kind of just do a consultation. I talk to the parents about things they can try at home, and then we see if an evaluation needs to happen. And I'm very open and, you know, willing to talk to you about any concerns you have about your kids just outside of this age too. But I will say that it's important to kind of seek out support at this age if you feel like you have some questions, just because I think it's helpful. Just more information is always better than, you know, just wondering. So I will encourage you just to always ask. So yeah, I'll pass it on to Maria.
Thanks for having me too. I'm going to pass out these magnets. This is one of my favorite ones, and I have it on our door when I come down because I need to sometimes remind myself of things to say to my kids. And grab one. Also passing out a rack card about our ADHD testing. We don't start testing until 6, so I think everyone here knows to be remember that. There's a discount coupon on there, and that will last till whatever that will be offered when we present to folks. The reason that we don't start testing until 6, because you can test before 6 for ADHD and other things, is that we don't want to diagnose development. What I mean by that, and I love that you're giving out the development chart there, is that kids develop in all different stages and ranges, and there's certain things that we really want to make sure that we capture early, because earlier intervention is going to be better. But in the realm of mental health and behavioral stuff, a lot of things can look like things that are really just development in action. So we start our testing at age 6. That's when we really start to see, is this kind of going away from the norm, and is this something that we want to maybe intervene on differently. So Maria Paredes, I'm owner of 3 Years Counseling. We're a group private practice here in Greensboro. We also have a satellite office in Raleigh. There's 9 of us, and we do a little bit of everything. We see all ages. We see adults, we see families, we see couples. But in terms of children and families, we do a lot around parent coaching, a lot around behavioral coaching, both from the testing angle, in terms of seeing, is there ADHD present, is there learning disability present, is there high IQ, and you know, that can sometimes be just as much as a disability in certain ways than having dyslexia. Because a lot of times when you have a high IQ, you have uneven development in some ways. So a child might be very high academically, but socially emotionally there's a gap, and that gap can cause a lot of difficulty in different areas. The younger child is, the more inclined we are to do parent coaching than we are to do direct care with the child. We are trained in play therapy, we do play therapy, we know how to do that, but more and more, the longer that we do this work, feel strongly that if we can intervene at the parent level, it's going to have a greater impact. Not because it's the parent's fault, not because the parent's necessarily doing something wrong, but because when there's a difficulty, if we can give the strategy to the parent who's with them, more than just the 50 minutes that we're with them, we're just going to have a greater ROI, greater return on investment. And also, if the younger child is, and I know you all probably get this too, like some of these kids that we'll see, they've gone to 20 different appointments, right? We're trying to figure out what the issue is. And sometimes through that process of going to so many different providers, the child starts to internalize, there's something so wrong with me. There's something so wrong with me that mom and dad couldn't figure it out, and they had to go to all these experts. And sometimes that process is really important, right? To figure out what is the core issue and what we need to do. But we really try to really send in that message to the child that their parents can't handle it. We want to empower parents that you've got this and you're going to be the best person to be able to help your child, at least from a mental health behavioral perspective. Obviously, again, when there's specific structural or other issues, we need specific intervention, and that's important. Like I said, we do a little bit of everything. We also do a lot with eating disorders and body image, trauma, anxiety, depression, all the sort of general mental health concerns that we can think of. We are at a network, we're a big practice. I always like to be very transparent about that. I'll spend a lot of time on the phone with folks if they need to use insurance. I'm well networked with, my husband's also a counselor. We've been in this area doing this work for both for over 35 years, and so we know a lot of people. So if we're not the right fit, we are committed to getting you to the right fit, whether that's insurance-wise or otherwise. Those are the main things, but happy to be here, and thanks for having me.
Thank you, ladies. I love hearing about the different disciplines and hearing how we can collaborate and work together. I think it's important to have multiple people giving different perspectives. And so today I'm here to talk about occupational therapy. My name is Belanger. I am a certified autism specialist and autism spectrum disorder clinical specialist. So I want to first talk about what is occupational therapy. So I think a lot of times, speech therapy is very well known about what they work on. Physical therapy is very well known. Mental health is kind of given. But occupational therapy can be kind of a vague concept because we do cover so many different areas of development. We work with so many different populations of people too. But in the pediatric realm of what we work on in occupational therapy is developmental skills. So a child's only occupation, per se, is to play, be social, and to learn, in an academic setting. And so we use play as a modality to achieve developmental milestones. And so the areas that we work on include fine motor skills. This is how a child uses their hands for functional purposes. It may be manipulating small items, it may be holding a pencil, crayon, marker, drawing, writing, coloring, cutting with scissors, doing buttons and zippers on their clothing. We also work on visual motor skills. So this is how our hands and eyes come together to produce hand-eye coordination, which we also see during handwriting. We see when a child's doing puzzles or even just navigating their environment. We also work on their cognitive skills too, so identifying their ABCs, colors, shapes, numbers. We try to facilitate some communication, although we leave the more intense communication to speech therapy because that's their area of specialty. We also work on self-care skills. This is a really important area that we address in the preschool age. So this is going to be how a child is feeding themselves, using utensils appropriately, how they're dressing themselves. Like I said, buttons and zippers, putting on socks and shoes, tying their shoes. Also bathing, brushing teeth, toileting is a huge area that we work on too in the preschool age, learning how to wipe their bum after they go to the bathroom. Another area that we work on is sensory processing. So sensory processing is another term that can be kind of difficult to understand, and it's kind of thrown out there a lot right now. A lot of talk about sensory processing disorder. And so essentially sensory processing refers to how our body is absorbing and taking in all the sensory input of our environment throughout each day or in any given moment. So we actually have 8 different senses. We have our sense of touch, which is our tactile sense. We have our auditory sense, which of course is what we hear. Our visual sense, what we are seeing. Our olfactory sense, which is what we are smelling. Our gustatory sense, which is what we are tasting. And then we have our sense of vestibular, which is our sense of movement in our body. We have our proprioceptive sense, which is our internal awareness of our body, of where our body is in space. And proprioceptive can be a little bit hard to understand, but it can be deep pressure, it can be deep touch. It can also be, one example that I did is like if I was standing here with my eyes closed and somebody came up to me and moved my arm in this position, I would have an awareness of where that arm is and be able to recognize on the other side, our sense of proprioception. And then we also have another sense which is extremely important, our sense of interoception. And interoception is our internal body awareness, which signals our sense of thirst, our sense of hunger, when we have a full bowel or a full bladder, and know when we need to use the bathroom. And so all of these senses together, in any given moment, we are absorbing all of this input from the environment. Our body and our brain tries to organize it, and then we produce a reaction from it. And so sometimes we see kiddos in the classroom can be overstimulated by everything that's going on around them because there's lots of noise, there's lots of auditory input, there's lots of visual input of other kiddos in the classroom, posters on the wall, lots of things to see. Other kids may be touching them, or something, they're sleeping in their chair, they can feel that. Maybe tapping their clothing is bothering them. So there's lots of different sensory input in the classroom. And again, sometimes we see moments of dysregulation where they are overstimulated, too much going on in the classroom, and then we see an outburst. And in those cases, we just need to recognize the signs of dysregulation, try to help a child calm down, teach them some coping skills, teach them how to self-regulate, bring themselves back down to homeostasis before we can ever expect them to do functional tasks. One of my favorite sayings is regulation before expectation. So we always need a regulated child before we can ever expect them to do something functional at a table, anything academic-wise, and also communication-wise. You have to have regulation before communication. We see so many times that a dysregulated child is screaming and crying and throwing themselves on the floor and cannot communicate their needs. They can't speak in that moment. They can't say, I'm frustrated, I'm sad, I'm overwhelmed, I'm hungry, I'm tired, what have you, because their body is dysregulated. So that's a key component there. I do have a handout for you all. I think we can pass that around. I wanted to provide you all with some simple everyday strategies that make a big impact on your child's development. So, as I said, occupational therapy covers so many different areas of development. I could go on for an hour and a half. Like Ms. Dana said, I came in to talk with teachers, and we went on for like an hour and a half about everything child development. So I wanted to include, some practical tips and also like the science of why these things are important. So, for example, on the first page, we talk about encouraging outdoor play. This is really important for strengthening your child's body. So core strength and upper body strength is really critical in being the foundational skills needed for building proximal stability so that we can have distal control. Meaning you have to have a strong core, to have a strong shoulder, to have a strong elbow, to have a strong wrist, to have a strong hand to be able to produce good handwriting. So outdoor play is a really great way to facilitate that. On the next page, you're going to see talk about fine motor skills, fun ways that you can practice these skills at home, maybe from coloring, drawing, cutting, using Play-Doh to help strengthen the muscles within the hands. Talking here next about self-care skills. I understand in the mornings and with busy routines, it can be easier just to sometimes dress your child for them, put their shoes on for them, tie their shoes for them. Wipe their bum after they're going to the bathroom. I'm a busy mom too, and so I totally understand, a lot of times we're just rushing out the door and we have so many things to do. But, some practical things that you can do, I always suggest like on the weekends, on a slower day where you're not so busy, not running out the door, give your child the opportunity to dress themselves. Even if they put on a shirt backwards, even if the buttons are misaligned, even if they're having a hard time with the zippers, let them struggle for a moment, for them to start to practice to do it on their own. Let them put their shoes on the wrong feet so that they can feel what that feels like when the shoes aren't on correctly. Just give them some time to do things on their own. Wiping their bum after they go to the bathroom. That's a huge area that we see in preschool that can be problematic because teachers are having to take the time to go to the bathroom with the child, taking time away from their academics and what they're teaching. And so one way that I like to practice that you can do it in a fun way with a child, take some peanut butter, rub it on the inside of a bowl, and practice with a wipe and have the child wipe the peanut butter out of the bowl. So they're practicing those fine motor skills of how to wipe the peanut butter out. If they get some on their hand, no big deal with peanut butter, or if there's an allergy, something else, Nutella or jelly, or what have you, something that smears. they'll start to learn the skills of how to wipe it without getting their hands dirty. Another fun way to do it too that I've done with some of my kids that we work on is in a chair, we'll blow up 2 balloons and take the balloons onto the back of the chair, smear a little peanut butter in between the 2 balloons, and then come reaching back and wiping. Kids love it, they, are laughing hysterically the whole time, but it's a practical way to teach that skill. So that's something really important, in this age that we would like for them to be independent in. We also encourage, getting on the floor with your child and playing with them, getting on their level. Imaginative play is really important at this age. We're playing with dolls, superheroes, animals, kitchen sets, those type of things where they can imitate those skills. Limiting screen time is really important too for your child's development. I totally get it. A lot of times we have the TV on. I have the TV on in my house and I have a little one. But trying to, again, facilitate those imaginative play skills are going to be really important for their development, and trying to limit their screen time to about 1 hour per day at this age in the preschool era. And then I just included also some mealtime tips for healthy eating habits. So, a lot of times mealtimes can be a struggle in the family with picky eaters, with kiddos who, have certain preferences on foods. And so I just included some tips there for you all, like avoid short order cooking, meaning that everybody eats the same meal, limit distractions during meal times. It's a great idea to start teaching like table-time manners too, that they can replicate in the classroom. So staying seated until everybody is finished or until they're given permission to get up. Helping with cleanup also is important. And then just a little tip there for a quick daily routine, which helps support development. So in the morning, getting dressed on their own, brushing their teeth, having them help pack their snack is important. In the afternoons, encourage some outdoor play, puzzles, coloring, Play-Doh, imaginative play. And then in the evenings, you can do family dinner. Have the child actually help out with preparing the meal too. That can really help with desensitizing against any aversions or sensitivities they have with different types of foods. And then just some quiet activities after dinner too can be helpful. So even if you can just implement like 1 or 2 of these strategies or tips like per week, I think that that's realistic and able to be achieved. So, if there's one area of development that your child may be having a hard time with, just pick 1 or 2 tips to implement throughout the week and it can really make a difference in your child's development. So that's all for our handout. We are partnering with the school to do developmental screenings, and so some of you may have seen us send out an email advertising that we're doing free developmental screenings in the school. If you have any concerns about your child's development, we would love to come in and take a look at where they're at. We give you age equivalencies on each skill that we've looked at. It's been really helpful for other students at other schools where we just give a little snapshot of how your child's doing developmentally. When we hear teachers express concern about how a child's doing with their fine motor skills or their self-care skills or their attention in the classroom, this helps give some insight. And so after that screening, if we find that your child may be appropriate for occupational therapy, then we would work with you to do a full evaluation, and if we need treatment sessions, we are available to come to the school for treatment, and then we also specialize in home-based therapy. So we actually don't have a clinic space or an office where we see kids. We come directly to your home or the school if it's more convenient. So that's all about OT. I know it's a lot, so many different areas of development to talk about with OT. But if you guys have any concerns, I would love to chat with you all and answer any questions. Thank you.
Thank you very much. Let me grab the question box, and if anybody wants to start, if you just know off the top of your head that you have a question for anybody, you can just throw out the question, and whoever it's appropriate for can answer. It might be multi.
I do want to throw in, because I forgot to say, we do have 2 Spanish speakers, native Spanish speakers, so since you mentioned there's some, sounds like other languages represented here, so.
Okay. Yeah, we have lots of different languages spoken at our schools, right? Yeah, it's special. Okay. All right. This first question is how do you encourage a 4-year-old to be more independent? Feels loved by helping and with acts of service. So.
That's mine. If my 4-year-old, I get
part to encourage that continuation of the skill. It sounds like you said that she learns well through helping others. So maybe to encourage her to go on her own, I would encourage her to help you with the baby, for example, and ask her, can you help me put on his socks? Or their socks and shoes. And start with that, because it sounds like that maybe she's motivated by helping others, and then, once it's their time, once their socks and shoes are on, okay, now it's your turn, and then encourage her to do her socks and shoes on her own too. Or also use it as a teaching opportunity too, so say, they're learning to put their socks and shoes on, let's show them how it is that we put our socks and shoes, and, you can make a little song out of it, you can teach them left and right, sides of their feet. I think that could be a strategy.
I have an identity for that too.
So I'm huge on visuals, so I don't know if you can see this, like I'm moving towards something. And so there's different opportunities, I kind of start with a visual and then I phase it out. Because in our busy lives, we don't always have the opportunity to have something visual. But if you have this like by the door, there's things that we do, it can be a starting place. So, and we can make different board maker activities, those stickers that we put on here, they can Velcro it on and take it off. So I like to start with visuals. Visuals are so much more salient than what we say. And so, for our busy lives, I would say start with visuals and then we can kind of phase it out. So.
Are you meaning visuals of these are the things we need to do in the morning?
Exactly.
Okay.
Yeah.
And I'll just bring up ideas and just add, I would just name what's behind the desire. So, like, you really want mommy to give you attention right now, or you really want mommy to help you with that. I can't right now, but here's what I can do. Like giving them an alternative. So naming the thing, instead of, because our impulse sometimes is to go, no, or I can't.
Yeah.
So,
And I feel bad saying no to the help because I know feelings and everything.
the desire's okay.
Yeah.
I hear you, I see that you want me to help you with this. I can't right now, but here's something I can do, or here's what you can do.
I think one thing we see a lot with our students who have like little siblings, that they can't do some of the things that our preschoolers can do, but they see they're getting this one-on-one undivided attention. The baby is getting that undivided attention, and it's like, I know how to do this, but I want the same thing. So, yeah, but I think that's an amazing answer too about that she could help him learn to do it, and that she's helping him, and that just seems like a no-brainer, but it was nice to hear you say that. Because I think that it's you do just have to take that and just like twist it a little bit. And in the busy moment, it's hard to think of those things. So.
Great, but you're in it too, is what I say. So I also say to you, like, it won't always be that hard. Like when they're that age, they're little leeches, and they're trying to get everything from us, and it does get easier, and they become more independent, capable.
And I think that's one thing we see because we have the privilege of interacting with them. Like even in the twos class, the conversations that we have with these children, and they look so tiny, but the conversations that we're having are not baby conversations. So they have so many interesting thoughts and can contribute so much to a conversation. And I think that like we take the time at school to help them become more independent in what they're doing just because there's more children and we need everybody to help a little bit. So I think that sometimes people, maybe other people in their lives too, think, oh, they're so little, they don't know how to do that yet. But they can. They might just not do it perfectly like we think it should be done. But like you were saying, letting them help to get dressed. Like it's okay if they want to wear a top and bottom that don't match. They can come to school like that as long as they have clothes on. Like if they want to express themselves that way, I think that's fantastic. But letting them practice doing those things, and then we are not saying, you didn't do that right, and then that's not really validating like their abilities. And so I think like they don't want to do it again if we're saying, well, we didn't do that right. So like I think it's hard as adults sometimes to just let them be messy in the way that they're doing things because they're practicing how to do it. Just my little tidbit from the classrooms. Okay, so the next question is, no words at 1 yet, should I be concerned?
So that's a great question. lot of jargon, like where it's not a real technical word, but there's a lot of vocalizations behind it. So by the age of 1, my recommendation would be to talk through your day. So I haven't really given you guys a lot of like easy things, but on this table, you'll see a lot of toys, a lot of things, but you don't need the things for communication. You can honestly just talk through your day. So the way to support a 1-year-old would be like, mommy's gonna cook, do you wanna help me cook? Ooh, look, pop, 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 here goes the bubbles in the pan. Ooh, it's hot, do you hear that? Oh, hot, yes. So you're modeling the communication and the easy first words. Ready, set, go. Look at that ball, it's gonna go, ball, ball, ball. So you're modeling those early words. At the age of 1, we want a lot of vocalizations, but we're not necessarily bent on making sure that we are saying real words. It's just how much babbling, how much vocalizations are we saying, and is there intent behind it? And so if there's no true real words at all, that's something we can kind of talk about, but we'd like to at least have the intention for communication and that vocalization piece. And that's where the norms are just that. So your child is always independent, they're an individual and they're all on their own trajectory. And so this is always a starting point, and that's what I like to tell families too. Norms are wonderful, but there are always going to be strengths and places that just need a little bit of support. So, kind of that, hope your question a little bit. Yeah.
I think that goes to the fact of I've had some people just when I'm, giving tours and that sort of thing, people saying, well, they're not old enough yet to really understand what I'm saying. And so they feel like they don't really have to talk to them or have a conversation because they don't think that they know what they're saying. But they are, from teeny tiny, they are learning like to make sounds and actually they do know what you're saying. So it is just really important, all of that conversation, making sounds and doing rhymes and all of that is just like the build up to actually being able to talk and to know that sounds, that letters make sounds and then the letters together make words.
Yes, and just to piggyback on that as well, so Maria and Monica, really talked about play, how important it is. Get messy, get on their level, so get down on the ground. Get face to face where they can see your expressions, they can see, make it fun and loud and exciting, and just, really make it something that is very special for both of you. So that social communication is just huge. It can go so far. So I always say, get down on the ground, get messy, let them throw the sand, whatever they need to do outside when it's appropriate at home. But yeah, just let them explore and really just give them the language by you kind of talking through your day. That's the easiest way to kind of facilitate language and speech sounds and all of the above.
Great questions. Okay, so under mental health question, how do you stay calm and regulated when you don't get a break? If you don't have a lot of help with childcare? I appreciate good questions. The joke is saying, don't stay calm. Get a break, but
the biggest thing I think is just being gentle with yourself and patient. It's not going to be any one thing that we do with our kids that's going to make the biggest difference. It's going to be the aggregate. So being gentle with yourself, I can't be a perfect parent. We do a lot with eating disorders, for example, and sometimes parents will really blame themselves. Oh, well, I said this thing or I did this thing. And I want to always just try to help them see, like, we're all going to make mistakes. We're going to say the wrong thing. We're going to lose our temper. One thing like that is not going to be what makes the difference in creating an issue, whether it's eating disorders or depression or something else. It's going to be the aggregate. And our children are going to see us modeling that too. But if they see us being gentle with ourselves and us preparing, you know what, I lost my temper, I'm sorry. I'm going to tell a story that I might regret after. I have 3 kids and they're wonderful and they're hard. And there was a time, my oldest is a very vibrant child. She is, not saying this in a bragging way, it is what it is. Her IQ is ridiculous. They wanted to move her up 2 grades when she was in kindergarten. She, very high IQ, socially and emotionally has struggled, which is very common when you have that sort of uneven development. And it's hard to parent a genius, because they can like do circles around you, And my husband was out of town, and I had them for like I think a week or something, and Sunday night just spent however long making the meal, and I, have everything out. I call her for the 19th time to come to the table, and she comes to the table, and she sees what I made, and she picks up the plate, she's like, I don't want to eat this. And she said something like, sometimes you're such a effing idiot to me. Okay, now my kids don't curse like that generally, okay? And I was just at my wit's end. I slapped her across the face so hard, guys. I knew halfway through I was already walking away because I knew I had lost my cool. We don't use physical discipline in our house, It's not something I'm proud of, it's not something I encourage. I knew already halfway through it happened. And I bolted outside, and the other two kids are crying because they think I'm leaving, And I call a friend, and I'm like, I am just sobbing. I'm the worst mom ever. I just did this, I can't believe it. How could I do this to my kid? And my friend's like, oh yeah, I would have done it too. You're gonna go back in there, you're gonna make eye contact, you're gonna remind her she can't talk to you like that, you're gonna say you're sorry, and your parents gonna be okay. And I did just that. I went in, and the funny thing is she came to me and she wanted me to hold her right away, right? Oh goodness, this is like battered wife syndrome or something, right? She's like, but I think also speaks to that, right? I made a big mistake. I'm not encouraging this. And we repaired. I said to her, Carly, I love you so much. You know that I'm not okay with what I just did, but it's also not okay for you to talk to me like that, right? And so we're going to work through this. We're going to come up with strategies, but you can't talk to me like that. I'm sorry, Mom. And then we move on. It is an extreme example, and I always hesitate sharing it, but I like to normalize it. We're all, hopefully not to that degree, but we're all going to lose our cool. We're human beings. It is the aggregate that matters. It's not the any one thing. This is now years later. She's a teenager, and she's like, so Mom, remember that time? You slapped me? I'm like, yeah. And do you remember what you said to me? That sweet little face of yours now? We're looking at the long game. This is a marathon, not a sprint, and we have to be gentle with ourselves. So I don't know if that, in the moment, deep breaths, sometimes I purposely dissociate, like I'm there and I'm with them or whatever, but I'm like, in a couple hours I get to go Netflix and chill in my bed when they're asleep, and then we keep going, and we keep going. I'd also say, ask for help, wherever you can get it, right? Don't be afraid to ask if it's whether it's a family member, hey, can you come help? Can you just come sit with that kid for a minute, a neighborhood kid that you trust, but you have to get breaks if you're not getting them at all. It's just so important.
I think also just in our society today, we feel like we have to be top-notch and perfect at everything. Yeah, and at everything, always have the answer, just producing all the most perfect things, because I think that's kind of what's in front of us. And we are all just trying to survive. So I think being kind to yourself that you don't have to do it all and be perfect. And sometimes it is just knowing in our schedule that you need to say, no, I can't do that, because I think saying yes to everything that is coming, we're invited to, or that is around us, you know what, I know I can't do all of it, so even just during this time when there's so little, it's okay to be we just can't do that. And allowing yourself time to actually have some downtime, or just time with them where you're not having to, I just see that a lot. I feel like people just feel like they have to have everything together and be so perfect at everything that they're trying, because it appears that everybody else does. So
I want to comment on that too. I think also another component of that is moms get overstimulated too. I know when my baby, I get very overstimulated, especially if you're a breastfeeding mom. I'm still nursing my baby, and I get overstimulated a lot of times. Like even last night when I was putting things together to get ready for this, I was very overstimulated. I think it's important for you to the signs within yourself when you're overstimulated, and taking a break, even if it's just, putting the child in another room so that they can, have quiet play. Also just changing up the environment, like being outdoors does wonders for kids, for your own grounding experience, being able to calm your own sensory system, and also for the child to have a totally different, viewpoint, or for their sensory system to help calm them, or give them something to distract them so that you can just sit there, like even if you maybe close your eyes underneath the tree, hear the breeze, hear the birds. That's a really important component, I think, of parenting, that sometimes we see it as frustration, or you're getting mad with your child or something, but it's really overstimulation. I mean, it happens to all of us. We get overstimulated by the noise, being touched out, our kids touching us all over, the toys. For me, it's the crumbs on the floor, and my feet. That's enough to send me, like, my baby touching me, and then the crumbs on the floor, that's enough. Like, there are days where I'm just like, oh my God, I can't handle this anymore, let's go outside. And so that will, change our whole perspective.
What she's speaking to too, the conscious discipline parenting stuff, it's Dr. Bailey, is great, and it's a lot about how you regulate yourself first and modeling that. The book that I love the most by her, but if you Google conscious discipline, the stuff will come up, but it's called Easy to Love, Difficult to, something like difficult to parent, easy to love, or something like that. But it has really great advice in line with what she's saying.
As a mom, I heard a parent say too, piggyback on that, I love it. It's like your child, if you're feeling overstimulated, you can tell your child is losing it, melting down, take them outside or get him in the bath. So think about water and being outside changes the whole dynamic. And that helped me, I will say.
Yeah. Because I have twins 1-year-old, and sometimes I'm also like that, and sometimes I would like say something bad or get emotional or something. And I remember afterwards, I think it's quite important to have a European child, because many of us, we had some issues with our parents that were there probably. And if my mother used to be also like that, getting like that, and I was a child, and I thought that when I grew up, I would never do it. I would never do it. And then when something like that happens, and you actually realize you're behaving in similar situations, the same manner, oh my gosh, it's not the ideal. I imagine that to be. But what is important, I found for me, is important that talk afterwards to the kid, as you said, like to talk afterwards, and especially for me, it's important to say that it's not your guilt for the kid. Because I don't know about your parents, but I think maybe in our culture, in our family, like if something like that happened, the parents didn't talk about how they felt, about the reason, about that. Now, being a mother and growing up, I understand that she could be like that. She had the right to do like that, because when she came from work, she was tired, and then all these household things, and then me maybe doing something, like, overstimulating her, giving some personal issues, it happens, sometimes, but as a child, you don't understand that, and if a grown-up person doesn't explain it to you, she then tends to feel that it's their guilt, that they don't want to do something right, their own, and it happens too often, so that may cause them feel like something's wrong with you, and not like.
Are you saying that it makes the child feel guilty that they're
It makes the child feel guilty, the grown-up doesn't explain to him what he feels. Like, I didn't have that explanation, so if something like that happens, and then I realized it's not an ideal, and it's not the way I wanted to say it. But also, I try to talk to them sincerely and say, I had a very busy day, and I'm very tired, or I spent 3 hours with you at the playground, and my legs, my feet, my legs hurt. I just want to lay down, you just watch your cartoons, and let me just have rest. Or you for months, it's time to kill a 4. You have to do that.
And when you're speaking
It's
to,
overstimulated or over like emotional to that, but at the same time say, okay, but at this age they're able to do that. Like, and I shouldn't just, like screaming out something, wow, what did you miss? Like I'm tired of this mess. And like we start like, let's say I get tired cleaning after, like we have meal, help me. Like we have now, like since a couple of weeks ago, when they got this like tiredness and they said, hey, they're able to do that. So we made a rule, like after they eat, they say thank you, and they took their plates to go see, and they're able to do that.
and it feels good to contribute for them. Like it feels good to feel like I'm helping mom. And that's so
And
great
there
to
are
do.
some clear rules, and this makes me like less stressed. They know this rules, they say, fine, that's a rule.
Yeah.
So yeah.
And I would say like fast forward, because we end up seeing, like we see a lot of teens and young adults, and I think as parents we worry so much that that we can be softer and maybe whatever, but we see the opposite issue of we see kids later on who their parents never had boundaries or never expected anything from them, did everything for them, it's not just helicopter parents, it's the lawnmower parents, they're clearing the pathway in front. And sure, we have college students who, they don't have the skills to go buy themselves milk, or whatever. And so it's also okay, just like you're saying, to have expectations, and it makes them feel good. I'm contributing, I'm helping the family. It gives them ownership. It's not just I'm receiving. It feels good to be able to feel like I'm participating in this family. That's great.
Thank you for sharing that, because I think everybody everybody can relate to what that feels like.
And I think, go ahead.
To kind of piggyback on that, we've been working on that with Autumn too, and she's starting to pick up, okay, well, Alden isn't clean enough, but I'm like, okay, we have to teach that, and I'm going to teach by example. And she even brought up, okay, well, why doesn't Daddy clean?
My son is 4 years old, and when I remember his parents was around the living room, and he just came from school and said, "Oh no, I need it." So I said, "Oh no, this house is so messy." Do you remember to take the trains out? Yes, it was me. And what we gonna do? Oh, I need to clean my beds.
Oh, that's great.
And they start to learn when something is out of the place and say, oh no, I do this and I need to clean because I want to do another thing and I can't. But I leave them because no, he needs to learn. He wants to play with another thing and he cannot do it because the lights are out. So
That's great. And we always sing a song with clean up too, so it's a little jingle and it gets them excited. Clean up, everybody everywhere. Clean up, everybody does their share. So, voice is not great. But if you kind of incorporate songs and play too, they love it. They'll do it at school, they'll do it at home, so that's something you can kind of tag on to maybe a not so fun activity, kind of put a little jingle with it, that's helpful too.
And I do think that they do feel special by knowing that they are helping you. And I think, like you said, to communicate what you're feeling is important for them to understand. Like you're working hard instead of that we're just taking on all this because we're trying to be good moms. And it's just our job to do everything for everybody. So I think
Do that because it's all.
So I think that it is very important for them to learn how to do things for themselves. And like you said, if you've never had to do anything, then you get to college and there isn't somebody doing it for you.
Yeah.
That's why we always say too,
teaching them how to do things for themselves, or when you're playing games, don't always let them win, because it's better that they have these experiences while they're still living at home with you than when they go out into the world by themselves and they never had to be resilient because they didn't know how to do something or didn't know how to, they didn't always win or whatever. Those are all important things. We think we're being kind to them by protecting them from having to do anything or all that. But it really is important that they learn how to do it while they're still home with you. So let's see. Great conversations. The 4-year-old is refusing to potty and having accidents. Is this normal, and how do we encourage no accidents?
That's fine.
Potty,
My daughter's very headstrong. She's very sweet, she's very headstrong.
She has a lot of opinions.
Yeah.
So I guess I would look at that from maybe a couple of different places. So does she have a skill to notify you when she needs to use the potty? Like, is she aware within her body when she needs to go number 1 or go number 2?
I think so.
I think so, okay.
Sometimes she'll be kind of constipated.
Okay.
And I think that can kind of interfere, but there are some days where she's just like, I wouldn't. And I'll kind of give her some space, like, the first time, like, okay, you say you don't want to go. So we're gonna try, after we do this, before we do that, like, for their next transition. And some days she's fine, other days she's not fine, and, has an accident, it goes in her hands, and I'm like, okay, well, let's clean yourself up, and I like encourage her to like clean herself up, like rinse out her panties, and she bites me on it, and it's like, okay, this is sticky, this is sticky. This is a natural consequence, but go in your pants.
Yeah, absolutely. So are we talking more so about going to number 1 accidents or number 2? Or both?
Both,
Okay.
but she more struggles with number 2.
Okay, so what I think about with like fear around and withholding going number 2 is when a child has a poop and if they are constipated, so it can be kind of like a vicious cycle. So like constipation sometimes can cause painful voiding. So if
She'll hold.
yeah, they hold it, it backs up, it gets hard, it gets painful to eliminate it, try to push it out. So it can start to build a cycle of fear, for one, fear of the pain of when it comes out, fear of, just the bathroom experience as a whole. There's a lot of sensory components in the bathroom. Sometimes there's sensitivities for the smells, the smell of our own food. All the components and sequencing of the steps of sit down on the toilet, or pull your pants down, sit down on the toilet, push it out, and then having to wipe, and having to wash your hands, and then if she's worried too about accidents and having to wash out her clothing, all the things involved, there's a lot of steps to it. But like constipation can cause a vicious cycle of withholding, and then you're holding it, and then you're constipated more, and then again it backs up more, it's more painful to let it out. So that can be a really tricky struggle. I would, encourage pushing more fluids, having her drink more water to help soften it, more fiber to help her go. Really looking at her diet to see if there's something that's causing the constipation, because that's really going to be like the root cause of like the fear that's coming and causing her to hold. And then, sometimes when you get to a certain point, you've held it for so long, and you can't possibly, hold it anymore, and then you have an accident. And then, it's just like I said, that vicious cycle that keeps repeating itself, and then it's like, well, I don't want to go because it hurts, and so I'm going to hold it, and then, have an accident, or I'm just going to keep holding it, and the pain gets worse, and then, it just gets more and more difficult. So,
And we tried, because we're poop's not hard, so we tried the marathon. It hurts super soft. So we're like, okay, I don't think this is the solution. So, I've been trying to talk with her about how it's important to not hold it in and explain to her, like, we listen to our body, because I've asked her, we try and talk about, how we can, like, going from our mistakes and stuff like that, and she'll say, Mommy, sometimes my body doesn't listen to me. And I'm like, well, there are certain things you need to listen to your body with, and is one of those. So it's so important, you have to go, you just let it out, so it doesn't build up and hurt, like it did that one time. So
figure probably food issues, so at night, you know, or after dinner, we can have things like a bottle of water, crushed ice, and those tiny little apples. And that bottle of water and apples, you get too much fiber, they've got enough water, that whole combination, you kind of push the fiber, you have enough water. But there's just something knowledgeable about, it's probably depends on the different glasses, and some crushed ice and those little apples. And they drink.
She's 4, and how old is it?
1.
I would also just be paying attention to like, is there any sort of power stuff in it? Because if she is picking up on, mom really wants this, you know, even if you're not pressuring, if you feel like pressure, and potty is one of those things that there's a reason Freud, this whole theory is like essentially based on it, that it's such a, I have to hold on tight enough, but I have to let go enough. And that dual process is the core of so many other processes in life. And so I would also think about like, is there room to experiment with just like taking off the pressure completely and seeing what happens?
Yeah, just let her go.
She won't be 16 in diapers. She will, you know, like outside of there really being a significant issue, most kids will figure it out. And again, I'm not saying like, you know, there could be whatever, but sometimes it becomes sort of this like, I know mom really wants it. I really don't like when schools like, my daughter's, my kiddo's preschool, the rate went down once they were potty. And the pressure it put on parents, I thought, because then the pressure it put on the kids, I felt was so not developmentally appropriate. Because some kids are gonna just figure it out earlier, some later. Imagine if we said like, oh, well, I will reward you if you walk sooner. Some kids are gonna walk at 10 months, some are gonna take till 16 months.
And I'm sure she was 16.
And so, yeah.
17 before.
Yeah, my oldest went from not whatever, like we did very minimal pottying, and she was like perfect. We're like, oh my God, we're the best parents. She didn't have a single accident until we started realizing that she was poop-holding. And so she was going to like 5 days not having poop, and then, oh my gosh, it was like terror, you know, because it was so painful, so whatever. With my second two, we did nothing, and they just. And I'm not saying that's necessarily the answer. We all have these anecdotal stories of what worked with ours or what didn't, but I do think there's so much pressure that we have to put on that. Of all the developmental tasks that kids are going through, potting is the one that I think we put the most pressure on, and expectation that it has to happen by a certain time, versus other things that we really let time kind of like, kids are gonna get there at different stages. Now, if they're going to kindergarten and they're not doing it, yeah, there probably needs to be some more intervention, like, but even then I'd say, how can we do it in a very low pressure, listening to your body, paying attention to cues, we'll figure it out. I can remember hearing my voice sometimes like, come on, you know, like you want them to figure it out. And I also would notice like, if we praised when she did it, you know, like, great job, they notice the lack of praise when they don't do it. So it's just a very pressurized, I think, developmental task. Just like lower the temperature, lower the volume up.
Nicole, I'm sorry, go ahead.
I think very part of our conversation was
Yeah.
I'm so happy.
because my development kids also have that. Even sometimes.
Yes.
I remember, and it was sometimes a year ago, it was really difficult. You would just hold it and hold it, and then it's become like hurt.
Yeah, you cannot.
But I remember we try actually to talk to him in that way, that it's like, it's not you doing this thing, but it's just to get out. So I'm not like, I take the attention from him to the talk, like, oh, it's really wants to get out, like, let's help it. It's like, yeah, it's not what I can tell you even more, like, when he did that, and we're just, look, it looks like a small heart. Look how many small boxes you get, and it's counting, so it's like you draw attention from him, doing something like from him, so he's not making this pressure on himself to the, like, actually something else. It wants to get out, and like, we're counting that, oh, it's so cute. It looks like, you know, like, it's not him, he's so we also try to do the awesome. But we changed the diet for him, especially, like more vegetables, soups, when they have soups, and they love soup, we go this really, like, especially like vegetable soups. Yeah, like plums, dried plums.
Yeah.
He eats it every day, and it's like really much better. So
Yeah.
that helps.
Yeah, our previous, and then we got like how the body works, and it kind of explains like each food, goes down in your tummy,
And also yogurts, and kefir is, yogurts with all this bacteria, that helps. Because we have that problem.
How does she do with chewing? Is that something she likes, the motion of chewing? Will she chew on her molars?
I don't know. She had trouble eating solids when she was younger. I actually wondered if she had like a tongue tie or lip tie because she breastfed all the time. And it was almost like she was on the patient because he had a lip tie and tongue tie. We had to get into release because he was strong on the bottles. But yeah, looking back, I wonder if she had some like oral stuff going on because she didn't really eat solids until she was like 2 and a half.
And that is her later side, so I would say, be mindful of that. So a lot of times I do work with kids that have, we call it ankyloxia, or a tongue tie and a lip tie. When we do see that, if there's kind of trouble transitioning from breast milk to solid, sometimes that does indicate there could be a restriction under the tongue. Sometimes breastfeeding is difficult, sometimes bottle feeding is difficult, and sometimes it's different transitions or speech sounds when they're older. So sometimes what happens with constipation, if you do have a tongue tie, what happens is the body is not able to manipulate the bolus where it needs to go, and so when we're swallowing, it kind of just sits on the stomach and kind of slashes down. And sometimes digestion is not able to kind of process that. So sometimes we'll have kids that have, just lump sums of, mess in their stomach. So what I would suggest is really the first aiding of digestion is really chewing. So really get chewing. So if you have, I have various tools, I don't have them with me today, but a little chewy tube. So you can chew on maybe 5 minutes before the meal on both sides, kind of get that digestion, that saliva going, and kind of cues the body, okay, I need to start the digestion process, and that might kind of help support. And so tongue tie is an area that I specialize in. My kids both were born with a significant tongue and lip tie, which set me down this rabbit hole, as a lot of you are, So it's important to kind of see how restricted is that tongue. Can we manage? We never want to compensate for the child, because a lot of times as a child gets older, there's other things that come as an adult, sleep apnea, we need a CPAP machine.
Well, she snores and she does snore.
Okay. So it might be a good idea to reach out to a pediatric dentist and have them kind of take a look. Also a certified oral-facial myologist, a speech pathologist that knows about tongue ties, and occupational therapists as well. Sometimes they're well versed in that area. So it might be worth a consultation just to see if there's some symptoms that can be helpful for her too.
Now, would it just be like the dentist goes to for pediatric dentist?
So I would definitely, I have various resources, so we can talk after too. There's a lot of different professionals that kind of specialize in that. And our pediatricians are just amazing. They have to know so much. But I will say, it's just a disclaimer, for an oral therapy, you want somebody that is really, has taken the extra courses. So sometimes with tongue tie, we'll ask our pediatricians and say, is there a tongue tie? So we'll say, can your child stick out their tongue? So that is never a good indicator of whether there is a tongue tie or restriction. So I will say, asking questions, getting more information is really, really important with that.
Yeah, because she was evaluated when she was a baby because she fed all the time and when she became, she's big, she's always been like,
Yes.
80% down, 90% down, and she's like, oh, well, she breastfeeds all the time.
Right.
I would say 2 hours of her not breastfeeding anything until she was like 2 and a half.
Yeah, so that frequent nursing, that frequency of needing the nutrients sometimes is an indicator, sometimes, not all the time. But yeah, so we like to evaluate the child where they're at and kind of see how we can support them without an intervention, structurally as a release or something like that. See if there's other things we can do. But sometimes I just like to put that note out there. constipation in older kids, sometimes, not all the time, can be related to like the oral skills.
Great conversations. Mike, I have a question for you. When you thinking back to when you said like if a child is dysregulated, so that they can't do the next thing, like to do maybe something in the classroom that you're getting ready to do, or if they need to, they can't calm their body or whatever to come on to the next task. What are ways to help a child do that, so like to help them come out of that dysregulation?
Yeah, so if a child is dysregulated, overstimulated, or, kind of having a tantrum or a moment of dysregulation, it's really important to co-regulate with them. So a parent needs to be regulated first before we can help our child regulate. And so, some ways for you to do that is to remove them from their environment, meaning like bring them to a quiet zone. Sometimes we have like quiet corners or like a sensory corner where they can utilize tools to help their body calm down. Might be like low lights, it might be soft cushions or a bean bag for them to snuggle with. It may be some visual stimuli for them, like a calming bottle that has like glitter and stars and leaves in it, that you can make at home. It may be just, just a quiet zone for them to just release everything that's around them, to bring down the levels of sensory input that they are experiencing, so that again they can calm themselves, regulate themselves once they are calm and able to communicate with you and let you know, what it was that was bothering them or what became worse. Or they may not be able to communicate these things, and that's okay. Once you notice that they're calm and regulated and brought down to their normal state, I would say, then you can reintroduce them back to what they were doing in the classroom. You can also, if they are seeking sensory input, have sensory needs that are not being met, that can also cause moments of dysregulation. So we see sensory seeking behaviors in a kiddo who's like getting up and running from the table. They're or possibly touching everything on the table and getting so distracted that they're not able to complete their tasks in front of them. And so when that's happening, we can use different tools in the classroom to help facilitate it and give them the input that their body is craving. It may be like sitting on a balance disc. It may be tying an elastic around the bottom of their chair so they have something to push against and kick their feet against. It may be giving them fidgets. You all see it. I've been, fidgeting with things while I'm sitting here, and that helps calm my sensory system. It may also be like doing joint compressions. So joint compressions are ways to compress their body and give proprioceptive input, which can be very calming for them. You can use couch cushions and have them lay on the floor and rest into their body using couch cushions or pillows. So there's going to be like a mix of, some kids need quietness and less stimulation and just like a completely quiet zone. Other kids need more input to help regulate their body. So we all have different needs, we all have a different sensory processing pattern of what our body needs to stay regulated and calm. And so that answer can vary. It can be taking them away and giving them a quiet zone, or it can be providing more sensory input. And we all have like that just right recipe of what we need. And as you learn your child's needs, you'll see, are they seeking, they need to touch something in order to be calm, or do we need to reduce the distractions and reduce the input in their environment?
We're getting close to 11 o'clock, so this has been an amazing conversation. Does anybody have any other questions that they?
My son is moving all the time. It's distracted. So, my husband and me, we are thinking about an extracurricular class. So I don't know what class perfect sports. I don't know, helps him to stay a little more, I don't know what he needs to do, more discipline, or he needs to take out all his energy.
How old is he?
It's 4 years old.
Little Jim with the swimming place right next door, the goldfish, both of them are so great. And the thing that I love about both of them, they're so developmentally minded. And then teach that, to the parents and all that. It's just such good input for the brain in terms of teaching the kids how to understand their body and motion. It's a safety skill if you're doing the swimming, but either one of those is great for active kids, for any kid, but, yeah.
Yeah, I would agree. I think swimming is really, really great to tire them out. It's a lot of energy as well. It's really great sensory activity too. Little gym is great because they're moving their bodies. They can jump, they can run, they can swing, they can slide, all the things. But if you do want like a more structured after school activity, like karate or taekwondo or jujitsu would be great too, because it does require them to move their bodies a lot. A lot of times there's kind of like training involved beforehand, strengthening and coordination exercises, which helps expel their energy, but then after the strengthening and coordination exercises, then they get more to the lessons of karate or jujitsu or what have you, and that requires more discipline. I think 4 years old is a little bit young, for those type of activities, but it's a great start at teaching self-discipline and following directions at the same time as allowing them to expel some energy. The same thing with anything like soccer, basketball, baseball, any of those team-based sports would be a great way to. And you'll find, as you trial and enter some different sports or activities what they gravitate toward, what they like. They may not be like an outdoorsy kid, and that's okay. So they may not like soccer or baseball. Maybe they like more so indoors, like basketball that's indoors, or karate or jujitsu may be more their thing.
Basketball or soccer would be probably part of that age. It's like working cats are good.
Yeah.
And it's a lot of, it's a lot of volunteer parents to that age. And like at Little Gym too, they do a lot of integrative movement. So they're teaching, they're breaking down all the things and then building them up. So it's teaching the kid, first you're moving your arm this way, then you're doing this, then we're putting together, then we're doing the somersault. And it's just really great in terms of that coordination. And the folks there, I think it's DJ now who runs it, and they're just really great. A lot of those places will give you a free first class too, so if you want to go try it out.
There's a twice taken up at when you say stay in place where you are stuck.
It's hard, it's hard.
Yeah, that age is gonna be hard.
What activity is better for you?
And I can give you some information about what those places are.
Yeah.
And what's really good for the brain too is always just moving, crossing midline. You guys talk about like we're always trying to like move our body side. So crawling, jumping, running, all of those things are awesome. So any activity we have for crawling, moving our body side to side, and really building that core. So like as kids are transitioning from preschool onto kindergarten, we just see a lot of kids are having trouble sitting still, and rightfully so. It's developmentally appropriate for them to sit down for such a long period of time. So we can develop that core and get them so strong here. At first, anything that is super easy, as much as we can, just build that core strength. That helps with breath work, that helps with stabilization muscles, that helps with communication, sensory needs, like mental health. It just helps everything. So think about the core and crossing midline like as much as possible. And that's what I was telling parents too.
Monica, you had mentioned when we were talking with the teachers about the importance of like actually being on the ground. Can you speak?
Yeah, absolutely. So just to echo that, so being on the floor is so critical. And although the developmental guidelines have changed where it's perceived as though crawling is not such an important milestone anymore from the CDC, crawling is critical for child development. And even if your child is little and they've never crawled, or even if they're older now, even 4 or 5 years old, have them crawl. It doesn't matter if they skipped it when they were young, get them on the floor and crawling now. Even as adults, it's literally beneficial to be on the floor and crawling. And so the science behind that is that when we are putting our hands on the ground, bearing weight into our hands, we are strengthening the little tiny muscles within our hands. We're strengthening our wrist, our elbow, our shoulder, and especially our core. And like Nicole said, core, having a strong core is going to be the foundation for so many different skills, especially fine motor skills, and that all ties into our handwriting. So no matter what age your child is, even 8, 10 years old, get them on the floor crawling.
Even doing like air walks.
Crab walks, and then crab walk soccer is really fun. Soccer, but in crab walk position, wheelbarrow walk. You can think of so many different animal walks. Call it
He was ready to look under the tongue for that result. Because sometimes if it's real tight, we might do a booty scooch, we'll do something like that, or there might be tension. We want to look under there, make sure there's nothing.
But the kids, I was so worried, but most of our friends, kids grow, right? Being, and I was thinking, oh, that we got to do the decision, they were fine. And I said, they seem to be fine, but then she was like, I want to make them come out.
Even just doing like games where you're trying to guess, or hopefully it's not videotaped. But do like races like this or something, that you're. Visuals are good. Yeah, but to do that, like you're bearing the weight and you're using some feet, so you can make it, obviously just make a game of it. But those activities, those really.
And there's something on YouTube that's called Cosmic Yoga. It's for kids. I love it. Everything is so well thought out. There are just characters and different themes, and it's this woman that has a background in CGI in the back, and she's creating characters, and she's doing different moves that are developmentally appropriate. And it's teaching yoga, it's teaching regulation, it's teaching breath work, how to calm ourselves down, mindfulness, all of it. So Cosmic Yoga is amazing. So just to so I don't have to think, okay, am I crawling and I'm doing Cosmic? Cosmic Yoga is a wonderful introduction to helping families.
And obviously everybody who's in the Forrest or Miss Annie's class, Miss Sharon does yoga and you're on the floor doing all of that, so these handles. So we do get that, but I think just doing, I think people just don't think about getting on the floor and doing those kind of things, and it is really good for them.
And that's amazing, because my daughter loves this right. So it had to be a treat. I will try, honey. So, talking about that, are there any places around Greensboro that does kids yoga? This is my daughter seems very, very serious.
Sharon, do you know, the only one that I know is, I think I gave Mona's name, and sometimes she does it when we have to sign up for things, but I think the kids are listed a little bit older, maybe first, second grade, but when you get up with your hands.
This isn't yoga, but music together. Music together is the name. The woman who runs the local one is named Leah, and it's music, but she incorporates movement. There's a lot of bilateral integration and stuff, and it hits a lot of the same things, just from a music standpoint.
And I think a lot of the theme of what we're saying too is actually, instead of having the children be sitting so much, is that be active, outside is just so important. Just like all of those movements are just so important for them. So we have come to 11 o'clock. This has been an amazing conversation. I really, really appreciate you all coming this morning, and thank you to all of our speakers. I'm not sure now. So all of our speakers for your amazing advice and input and knowledge on your specialties. I think I'll make sure that everybody has the handouts. I think there's more handouts on the table here. And if you will be around here for a few more minutes if you have any questions. But, yeah.
First of all, left hand rising, right leg rising, because I have like she's still feeling comfortable writing the left hand. And like, isn't there any difference when you write with this and
Yeah, I mean, theoretically, there could be, a little bit different brain structure from someone being left-hand dominant versus right-hand dominant. It just means that their brain operates in slightly kind of opposite ways. There's nothing wrong with that. I would certainly encourage them to use whatever hand they feel comfortable with. And, hand dominance doesn't really peak until like 5, 6 years old. They really decide which side they want to use. We're starting to see it emerge at 4 years old, yes, but then when they really get solid on what hand they want to use is around like 5. So there may still be time for them to switch over. I wouldn't shame them or try to correct them, just let them do what naturally becomes easy for them. Otherwise, if we try to correct it, encourage them to use the right hand, and we're kind of like rewriting the brain pathways for them, and then they're going to be at a disadvantage and having to have like an uphill battle of like trying to retrain their brain and how their lower systems work from their brain to their hands. And that can cause some delays and frustrations and make things just more difficult for them. So yeah, just encourage them to use whichever hand they're most comfortable with. And given that they're just, 4 years old, there's still maybe time that they may switch and find that their right hand feels more comfortable. It's really their preference.
yeah, that's what I do. See something and really see.
Yeah.
It's interesting though. Are they identical
My son
or
is the same. But he used the left for writing, but he used the right for eating and the like thing. So it's like he switched.
That's good.
Yeah, maybe they're identical.
I don't know what.
I don't think it really, it doesn't.
It doesn't matter one way or another. I mean, it just may be theoretically that they're stronger on one side of their brain motor-wise, and then the other side of their brain they're stronger, linguistic or communication-wise. Every child's brain is different, and so whatever comes most natural to them is
Yeah,
just
my
fine.
husband is with what, he's all for lefty, but in Florida, which is closer to that, and the ability that you have to write with that, right? So he was forced, he had a mean teacher.
Yes.
Force him to learn how to write with the right, so he learned how to use both. So as he was always writing, and everything he got home was left. And his parents didn't know him to. He grew up in Africa, he writes with the right, and he does everything on the right.
Yes, if you could do something like this,
That's it.
it's hard.
There was never a conflict, it was just, he grew up more like with that little trauma that the teacher put.
Yeah, they used to do that.
So me, I don't remember that, so at school he was always, had to force himself to listen to the right, and everything, he wrote it, everything, all the form, everything, left, and writing, it's right.
I think as long as you can write, you're good. Yeah.
I was an elderly grandmother, and so anything that I disagree with was that these people, they say, all the time, ESPN is a good commercial, so.
My kids are bilingual, so we speak Russian language at home, and we want to keep it this way, like to have the, like, for them to speak Russian and have that help, so I speak it. But at the same time, we're here for university, and like, we're here for a long time, so they're probably and they're only 4, and they learn letters here at school, and they like already recognize and write their names. That also that it comes from my family mostly. Like they say like, oh, how about Russian? You have to learn, you have to teach Russian letters. You have to teach them how to read in Russian. To keep it on that like really high level also as well. And I kind of don't want to discuss them that much, especially at that age. So I don't know exactly. Or I should teach them like both at the same time, or what I figure out most for myself. So since they will go here, like at school, and they need this level of English also, and they are learning letters here, so maybe let them like understand how to read in one language, and then after when they understand it principle of reading, like they know how to read, so I can have it as another, like second language, or because I don't want to press them like at once and mix those letters, maybe that's too much, especially if they're just four, and it's not, I guess, four, it's not like the main thing, like they should necessarily do, like reading and, you know, like.
That's a lot of pressure.
Yeah. My kids are bilingual, and
Which one?
Spanish. So my husband's Mexican, and they all started at the Spanish immersion school. And my copy, my doctorate program is second language acquisition. More language, like she said, it is nutrition for the brain. Outside if there's like occasionally a kid has an auditory processing disorder or dyslexia, if there's something else that's interfering with their general, sometimes it can be too much pressure, but generally speaking, more language is always really good. Huh?
Anytime.
Anytime.
It's so stressful.
Yes. When you look at the data on bilinguals, not only is their vocabulary higher and all that, but their empathy, their perspective taking, there's so many things it's good for. Their regulation, because you're not just learning math, like in one language and another math, you're learning infinite maths, so you're learning how to think in dialectics earlier than you typically see like in adolescence. Again, pay attention to your kids will tell you, right? Like if they're having trouble with something, again, there's a specific learning disability or something, then you don't want to put pressure on something when there's a need elsewhere. But outside of that, it's a great.
So I think it's fine to do it like without.
Yeah, but again, I wouldn't be pressurizing it, but yeah, like if you
In a fun way.
you know your kids best, pay attention to it, but the fact that they're hearing another language is so good for them in so many ways.
And the research supports that there's, second language learners that they might have a delay, like right initially, and then there's an explosion of language, they get it. So it's not uncommon for second language learners to, and I say delay, I don't mean delay, I just mean they're taking in the information all at once, it's a lot of information, so they may not be, extremely proficient in one or the other, they might just be taking all the information and kind of understanding it, absorbing it, and then they're organizing it in their mind the way that they can, express it later. So
At Jones, they only do Spanish, like day one, kindergarten. It's a lot of songs, and my kids are getting it already from home, but a lot of the kids there have never heard a single word in Spanish. And by the end of the first week, they're singing songs, asking how to go to the bathroom in Spanish, they're responding to things, and they don't get English instruction until second grade, maybe they start a little bit more in third, but then when they take their EOGs, they outperform their peers who are only learning one language. So even though they're mostly learning in Spanish, when they end up later on taking the EOGs, that second input actually makes them much better. So it's so good for their brain.
Marcella, did you have a question?
Yes, thank you. I have the same problem. My son is having problems with the sounds of the letters sometimes because it sounds like Spanish and English. So now he is like, Mom, what's that here? He's trying to learn to read. He's starting to read. So it's like, I don't know what is better. Teach him first to read English or teach him to read in Spanish. Because he is now so confused about the sounds of the words and the part. Because he knows in English and in Spanish talking about saying the words. But when he tries to read, it's hard for him. But he wants to read now.
Kind of like she's saying, it's hard, kind of you're saying, delay is not exactly the right word for it, because it's not necessarily a delay as much as integrating which is which. So, my daughter started at the Spanish immersion school, but then they moved, and with one of them, she would get things wrong because she was spelling phonetically, which is more Spanish. But that was something that over time just worked itself out, you know what I mean? So it looks like it's a delay, or it looks like they're not getting it, but it's more that there's just more that they have, and they need to learn that discernment over time, and they will, because there's going to be so much more input in school and all that. So I wouldn't, unless it's becoming a major issue, that there's clear
much, and I would let the parents or the teachers know. Because if they know, like, oh, that's why they're spelling this word this way, that makes sense, because that's the phonetic spelling that, they learn. It's not a,
And there's a lot of services in the schools too, so you have an ESL teacher that's usually present in the public school system, and they're phenomenal at being able to kind of decipher, like, how can I support this child who is learning 2 languages at once, and really break it down with the teachers as well. This is normal, this is developmental, and, kind of give tips too, so that it's more of a growing experience rather than overwhelming, if that makes sense. So I feel like from a language perspective, if it becomes too taxing on the child, you can absolutely focus on one, and then, for a few months, and then go back to the second. There's no trouble with that. So.
I have a question too, like from my own experience. So in our household too, we're bilingual, and so my dad only speaks Spanish to her, and I only speak English to her. Do you support the theory of one parent, one language, or in some other circumstances, maybe in your family, everyone in the house is only speaking Russian, and then only at school they're speaking English, or would
I say the more the better.
Okay,
Truly.
okay, yeah. So if I know a decent amount of Spanish too, should I be also speaking Spanish to her, or?
So that's up to you. That's definitely personal preference, whatever you feel comfortable with. That child's going to code switch, is what we call it. They're going to code switch with you and with their behavior, everything. So you might notice that she comes to you and says everything in English, and then she'll go to your husband and say everything in Spanish. But then she might say something in Spanish and say, "Oh, sorry, Mom," and so that is so good. So that's just helping the brain kind of everything's coming together. So no, I do not like that ideology of one language, one parent, one language at home, one at school. No, I say combine it all, mix it all.
If you go to Europe, these kids speak 4 languages.
Exactly.
More languages always going to be.
Yes.
And I was thinking too, something helpful that we do in our house is we have bilingual books. So a lot of the books that we have are written in both English and Spanish. So for every single page, every line is first written in English, and then next is written in Spanish. And so with your kiddo that's starting to learn to read in both languages, you can see about practicing strategies. So read the entire book first in Spanish, then read the entire book again in English, or you can do it page by page. And so read the first page in Spanish, then immediately after read it in English. You can try either way, but we alternate. We'll read the entire book in Spanish, and then we'll read the entire book in English. But as they're picking up certain words here and there, maybe you want to read one page at a time. Read it all in Spanish first, then read it all in English next.
Thank you.
Thank you so much. I'm excited that I got to participate in this and hear all of your, great ideas and all of the knowledge that you bring to, to us today. So thank you so much for coming and joining us, and thank you to you parents for, participating in all your great questions too.